Hello friends, I'm Dr. Jeevram. Today I will discuss about pneumonia and its treatment. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, causing cough with phlegm or pus, fever, chills, and difficulty breathing. A variety of organisms including bacteria, viruses, and fungi can cause pneumonia. The signs and symptoms of pneumonia vary from mild to severe depending on factors such as the type of germ causing the infection and your age and overall health. Mild signs and symptoms often are similar to those of a cold or flu, but they last longer. Signs and symptoms of pneumonia may include chest pain when you breathe or cough, confusion or changes in mental awareness in adults age 65 and older, cough which may produce phlegm, fatigue, fever, sweating and shaking, chills lower than normal body temperature in adults older than age 65 and people with weak immune systems, nausea, vomiting or diarrhea, shortness of breath. Newborns and infants may not show any sign of the infection or they may vomit, have a fever and cough, appear restless or tired and without energy or have difficulty breathing and eating. When to see a doctor? See your doctor if you have difficulty breathing, chest pain, persistent fever of 102 Fahrenheit or higher, or persistent cough, especially if you are coughing up pus. It's especially important that people in these high-risk groups see a doctor. Adults older than age 65, children younger than age 2 with signs and symptoms, people with an underlying health condition or weakened immune system, people receiving chemotherapy or taking medication that suppresses the immune system. Causes: many germs can cause pneumonia. The most common cause are bacteria and viruses in the air we breathe. Your body usually prevents these germs from infecting your lungs. But sometimes these germs can overpower your immune system even if your health is generally good. Risk factors: pneumonia can affect anyone, but the two age groups at highest risk are children who are 2 years old or younger, people who are age 65 or older. Other risk factors include being hospitalized. You are at a greater risk of pneumonia if you are in a hospital intensive care unit, especially if you are on a machine that helps you breathe, a ventilator. Chronic disease: you are more likely to get pneumonia if you have asthma, chronic obstructive pulmonary disease, COPD, or heart disease. Smoking damages your body's natural defenses against the bacteria and viruses that cause pneumonia. Weakened or suppressed immune system: people who have HIV/AIDS, who have had an organ transplant, or who receive chemotherapy or long-term steroids are at risk. Complications: even with treatment, some people with pneumonia, especially those in high-risk groups, may experience complications including bacteria in the bloodstream, bacteremia. Difficulty breathing: fluid accumulation around the lungs, pleural effusion, lung abscess. Prevention: to help prevent pneumonia, get vaccinated. Make sure children get vaccinated. Practice good hygiene. Don't smoke. Keep your immune system strong. Treatment of pneumonia: supportive measures, oxygen therapy if available. Lower the temperature if greater or equal to 38.5 centigrade, give paracetamol. If wheezing present, give rapid-acting bronchodilator, nebulized salbutamol. Ensure that child receives daily maintenance fluid appropriate for the children age, but avoid overhydration. Refer to IMCI, STG, and essential medicines list for children. Treatment of pneumonia in children. Treatment of very severe pneumonia: injection ampicillin 50 mg per kg IV or IM every 6 hours, plus injection gentamicin 7.5 mg per kg IV IM once a day for 5 days. If child responds well, complete treatment at home or in hospital with amoxicillin 15 mg per kg 3 times a day, plus injection gentamicin 7.5 mg per kg IM OD for a further 5 days. Alternatively, injection chloramphenicol 25 mg per kg IM or IV every 6 hours until the child has improved. Then continue orally 4 times a day for a total course of 10 days. If the child does not improve within 48 hours, switch to injection gentamicin 7.5 mg per kg IV or IM OD, plus injection cloxacillin 50 mg per kg IV or IM every 6 hours. Then continue cloxacillin orally 4 times a day for a total course of 3 weeks. If the child is not improving, use injection ceftriaxone 80 mg per kg IV or IM OD for 10 days. For children about 5 years, a typical pneumonia should be considered mycoplasma and macrolide erythromycin. Azithromycin should be considered as a drug of choice in addition to the above antibiotics or as a second-line treatment. Severe pneumonia, injection benzyl penicillin 50,000 units per kg IV or IM every 6 hours for at least 3 days. Then amoxicillin 15 mg per kg at hourly for 7 days. If the child does not improve within 48 hours or deteriorates, look for complications and treat accordingly. If there are no apparent complications, switch to injection chloramphenicol 25 mg per kg every 6 hours, IV or IM until the child has improved. Then continue orally for a total course for 10 days. Non-severe pneumonia, amoxicillin 25 mg per kg 12 hourly for 5 days. Give the first dose at the clinic and teach the mother how to give the other doses at home. Encourage breastfeeding. Treatment of pneumonia in adults. Community-acquired pneumonia. Typical community-acquired pneumonia, if mild to moderate, treat on outpatient basis. Then capsule amoxicillin 500 to 1000 mg every 8 hours for 5 days. Or tablet erythromycin 500 mg every 8 hours for 5 days. If severe, treat as inpatient basis, then injection ceftriaxone 1 gram every 12 hours for 7 to 10 days. Treatment of atypical community-acquired pneumonias. Tablet erythromycin 500 mg every 6 hours for 7 to 10 days. Pneumocystis jirovecii pneumonia. Tablet cotrimoxazole 3 to 4 tablets of 480 mg every 6 hours for 21 days. Plus tablet folic acid if cystopenic for 21 days. Alternatively, in sulfur allergy, tablet clindamycin 450 to 600 mg every 6 hours for 21 days. Staphylococcus aureus pneumonia, injection cloxacillin IV 1 to 2 mg every 6 hours for 14 days, or tablet or injection clindamycin IV oral 600 mg every 6 to 8 hours for 14 days. Klebsiella pneumonia, injection chloramphenicol IV 500 mg every 6 hours for 10 to 14 days. Injection gentamicin IV 4 to 5 mg per kg 24 hours in 2 divided doses for 10 to 14 days. Hospital-acquired pneumonia, empirical treatment until bacteriology available. Injection ampicillin IV 1 gram every 6 hours for 7 to 10 days plus. Injection gentamicin IV 4 to 5 mg per kg per day in 2 divided doses for 7 to 10 days. If Pseudomonas infection is suspected, then injection ciprofloxacin 100 mg, 200 mg IV infusion 2 times a day till temperature becomes normal. Then tablet ciprofloxacin 500 mg twice a day for 7 to 10 days, or injection ceftazidime 1 gram IV twice a day for 7 to 10 days. Multi-drug resistant Staphylococcus aureus pneumonia, injection vancomycin IV 500 mg every 6 to 8 hours for 7 to 10 days. Aspiration pneumonia is also common in hospital and involves multi-organisms with anaerobes, so injection coamoxiclav 600 mg IV thrice a day, or injection cefuroxime IV 4 times a day till temperature becomes normal. Then Tablet cefuroxime 250 mg twice a day for 7 to 10 days plus injection metronidazole 500 ml per 100 ml IV 3 times a day.